All right, what's up? YouTube Power Crew, Dr. Dan in the house, and I want to get you guys fired up today, and I want to teach you a little bit about what chiropractic care should be, what my view of chiropractic care is here at InBalance Performance Center in Cranberry, all right? So, number one, I'm a chiropractor. I became a chiropractor because when I was 13, 14 years old, I had really bad Osgood-Schlatter's disease, and the ortho told me to stop playing baseball. You've heard this story in all kinds of other videos. And I was doing this movement, but my knee was bad, and this knee was bad. And ortho says, hey, quit playing baseball, no sports. I got a little sad. I got a little upset because I was a young dude that was trying to run fast, but I had this pain that was negative in my body. And after like 3-4 months, my back started to hurt so bad. And my mother called and said, hey, we're going to try this chiropractic thing out. And then we ended up having back pain relief, which was awesome. But I wasn't training correctly. And so over the years, teenage years, college years, I started weightlifting and doing all kinds of different activities. But my body was out of alignment. And I didn't really figure that out until my late 20s, early 30s from repetitive pains in the shoulder and the hip. Other injuries, broken clavicle, little jacked up finger right here from stoving it, actually catching a football, and just general injuries that you start to feel in your body the older you get, right? So at this clinic, we're big on self-care, and self-care is, it's kind of like, how do you take care of yourself throughout the day? Do you think about how you're standing, how you're moving, and do you think about being in line, balanced, and symmetrical lightly? And do you feel where you've got some tension points at? So a lot of clients come in here and they've got, postural tension or, different sway forward, sway backward, hunched forward. And when we start to see how people stand, we start to see, man, you've got contractures, which are little muscle tension areas all through your body. And that causes this skeletal misalignment, and maybe it's a collapsed foot and a bad knee like it was for me, and then it's a bad gait, and now you've got chronic back pain, disc herniation, whatever. It stinks and it doesn't feel good. And once you start to notice where you're tight at, your brain says, man, I gotta get out of pain, right? So we're gonna talk about this real quick because this picture is amazing, it's awesome, and it's so beautiful, and this is who you are. Your brain is you. That's your consciousness. It's level one. It's the most important. We've got to balance the brain through bilateral symmetrical exercises and alternating dominant, non-dominant hand movements. And we cannot unilaterally play something or do something the one way too much early in life, because the older you get, now you've got major skeletal misalignments and nerves that are stronger on one side and weaker on the other. So in some of our videos, you've seen how we've done some bilateral clearing, right? And exercises to start to develop symmetry throughout the body. And in my chiropractic mind, my neurology mind, I'm like, man, does that feel good to get your spine wiggling and moving and your balls and sockets twisting and rotating? And as we ride this beautiful, smooth figure 8 pattern out, you start to unlock deep areas of inflammation within your body. It's crazy cool, but you got to stay focused daily on a number of different things that we're going to talk about, right? So, feet squeezers, plantar fascia, toe stretchers, straight foot balance stance helps us activate all the nerves down in the lower extremity, which actually helps us develop more core power and hips back, chest up, great lumbar alignment where we're not too slouched forward like this, causing disc herniation, stuff like that. We also don't want to be too much back here that causes like facet syndrome. So there's this nice little mixture of movement that you can get into, and we'll start to talk about how to feel the psoas and the QLs and the obliques and get everything moving in that lumbar spine and the pelvis, right? So level one is brain, and the furthest thing away is the foot and the little fingers. So it's common that we get numbness and tingling, carpal tunnel, pinched nerves that could be in the neck the whole way down the line. Or if you've got peripheral neuropathy, numbness, tingling down the foot, swelling down the feet, we got to get these nerves active. And to do that, we use a whole bunch of different modalities like exercises, feet squeezers, whole body vibration, and just mindfulness is number one. Cool? So from a chiropractic perspective, my job with you guys is to help create good self-care programs so that you don't have to come and get adjusted all the time, but you know what a good body feels like and you can ultimately unlock yourself on a day-to-day basis, right? So number one, bilateral symmetry, left side, right side, dominant, non-dominant side training, unification of the sides, but also unification and tightening up the upper body to the lower body through the core. And that's like breathing and movement and diaphragm focus, right? So we can get this diaphragm pumping, pulling, crunching, and feeling the obliques actually work. And you can do these exercises at the computer, in your car, anywhere you are, right? Left side, right side, upper body, core, lower body, brain's number one, spinal cord's number two, peripheral nerves are number three, right? So if we can get the peripheral nerves loose in the extremities, we develop the core power up in the spine. That's an important thing. We're going to move over here. And so as a chiropractor, right, you have to practice good spinal hygiene so that we don't end up with things like bad headaches, tension headaches, rotator cuff problems. My shoulder's so sore. I tore my rotator cuff 20 years ago and it's never been the same. And now that injury is all hiked up here, right? So as a chiropractor, we've got to reduce the fibrous adhesion, and we do that with manual therapy, but also massage therapy, whole body vibration therapy, deep tissue laser therapy, all these different therapies to help get that acute pain out of your body, right? But in the long term, it's brain health number one. We've got to think, we've got to be mindful, we've got to be aware that we've got balance through our feet and balance through our columns and balance through our extremities. And then number two, if we practice spinal hygiene, which means flexion, extension, rotation, side bending, the 6 degrees of movement, which we're going to add into this video, then we can confidently say you're going to feel better in these organs. And if we add in good diet, anti-inflammatory diet, some nutrients, some supplements, some mindfulness about getting our digestive tract pumping with the diaphragm, getting these lungs breathing and this stomach pumping all through here, maybe a little bit of exercise to get the heart rate up, and a little bit of decompression dead bug to get the heart rate calm. We've got to train each of these organs. We've got to move mindfully through our spine, and we definitely have to start all of that with grounding. And grounding means outside edge pressure, green dot pressure, stand with a nice high arch so that we've got a little baby bit of glute activation, right? And if we balance out the feet more and more, we wear the green dot out on the 4th and the 5th metatarsal, and we can start to see that, oh man, I'm applying pressure on the ball of the foot, which actually helps me in the long term develop more upright spine, more down low shoulders, and a nice healthy decompressed spine. So let's take a look through the clinic about how we achieve some of those things. Brain number one, spinal cord number two, mindfulness number one, functional movement number two. Let's go through that. We'll see you soon.